Hello, my name is Anani Eugenia Smith, and I will be presenting medication errors in pediatric patients and ways to improve both at home and in the hospitals. According to the U.S. Food and Drug Administration, medication errors causes an estimated 1.3 million injuries each year, just in the U.S. alone, accounting for one death every day. Based on these statistics, potential adverse drug events occur 3 times more often in pediatric patients than adult patients. Medication error is defined as any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. There are 5 rights of medication administration, and this is the standard that is used mostly in healthcare facilities nationwide. They are the right drug, the right route, the right time, the right dose, and the right patient. Following these medication rights usually helps to reduce medication errors. There are several causes of medication errors, and these include inadequate knowledge about drug indications and contraindications. People administering medications need to make sure they know the indication of the medication, contraindication, and therapeutic effects of the drug. Not considering individual patients' factors. Example is allergies. Not asking if the patient is allergic to a particular drug or not can lead to giving the patient the wrong medication and as a result developing an allergic reaction. Not following the rights of medication administration. Inadequate communication can also result in giving patients wrong prescription. Nurses need to repeat back prescription to providers to prevent giving the patient wrong prescription. Documentation is also very important. Documentation needs to be correct and accurate. Incorrect or incomplete documentation can lead to making errors whilst administering medication. Interruptions can result in distraction of the person administering the medication and hence medication errors. Dosage calculation needs to be done right. If not, errors will occur. Pediatric medications are calculated based on the weight of the patient. Fatigue and burnout can cause medication errors because clinical judgment is affected when a person is extremely tired. Health literacy level of caregivers and patients can result in making errors whilst administering medication. This can be from poor education or inadequate understanding of the medication that is being given. To prevent errors, caregivers and patients need education on dosage by weight because pediatric medication is calculated based on the weight of the patient. Pediatric medication errors can cause negative effects on the patients. Medication errors are of concern in the pediatric population due to the devastating implication for patients and are more likely to be life-threatening, especially death. The increased risk is due to the underdevelopment of their metabolism, which can affect medication clearance. Medication errors can result in allergic reactions such as anaphylactic reaction. They can also result in organ failure such as acetaminophen overdose. It can result in hospitalization, disability, antibiotic drug resistance, or underdosing that is causing the drug to be ineffective and then therapeutic effects cannot be achieved. Several strategies can be implemented to reduce medication errors in hospitals. Observing the patient to determine if the medication is working can help to reduce medication errors. Nurses need to always go back and assess patients to determine if the medication is working or if they are having adverse drug reaction. Looking things up if unsure is a marker of safe practice, not incompetence. If unsure, double check. Communicate clearly, state the obvious, write clearly and legibly. Remember, computerized systems still require checking. Always double check. Know which medications are high risk and take precautions. High risk medications need to always be double checked with another nurse. Medication reconciliation can be done with the patient or the caregiver and the family. Reduce distractions. This can be done by wearing a vest that has inscriptions on it stating "Do not disturb." Do not disturb sign can be put at the front door of the patient's room where medication is being administered or when pulling medications. Implement dose and dose range checking software programs in hospitals to provide alerts for potentially incorrect doses and to calculate and or check doses based on the patient's weight. Strategies that can be implemented at home to reduce medication errors include counseling in the language of the caregiver or patient preference. This helps with better understanding of the information that is being given. Written education materials needs to be appropriate for the literacy level of the patient or caregiver. Verify caregiver or patient understanding of the information or education that has been given. This will help reduce medication errors. This can be done by having the caregiver or patient teach back what has been taught. Multiple caregiver communication strategies can be implemented to reduce overdosing. Encourage the use of standardized dosing tools. This can help reduce medication errors. Patients or pediatric patients' medications are calculated based on their weight. Therefore, patients or caregivers need to be educated on how to do dosage calculation, since this will help to reduce medication errors. Provide dosage calculation sheets for patient or caregiver. This usually goes a long way. To be able to implement the above recommended strategies, Quality Assurance Manager, Director of Pharmacy, Unit Director, Clinical Director, Providers, Charge Nurses, and Case Management needs to be involved. The nursing process will be used in the implementation of the recommended strategies. When new strategies are being rolled out in an organization, it is usually met with resistance. The stakeholders' knowledge of the new strategy needs to be assessed first. This will assist in making a diagnosis. The diagnosis helps to determine where setbacks or resistance are in order to plan ahead. Planning involves setting goals. The goals help to determine which direction to go and in which time frame. After the planning stage, implementation can be done. Implementation involves providing education to the stakeholders through one-on-one education, webinars, and conferences. Evaluation can be done to see if the stakeholders understand what the new strategy is about and if they are willing to accept it or not. Based on this evaluation, improvements can be made. In conclusion, according to Bex and others, using two-person checks reduce medication errors by 41%. Computer-based checks reduce errors by 24%, and caregiver education reduced errors by 17%. Medication errors, which can be highly lethal, have become more common in pediatric patients. It is perhaps the most preventable cause of patient injury if healthcare professionals, caregivers, and patients paid much attention to it. This can help to reduce medication errors significantly and also save lives. Thank you for listening.